Good afternoon. My name is Ameenah Hall, and I am the event manager with the Health Collaborative. The Health Collaborative, we are a nonprofit, multi-stakeholder organization based in Cincinnati, Ohio. And we are the hub for healthcare in the region. Collectively, we work together to help serve the community. We lead data-driven improvements that result in healthier people, better care, and lower cost. And our services include a robust set of improvement-oriented benefits to our membership, including our 30 hospitals and healthcare systems, 150 long-term care facilities, and 100 select business partners. And today I have the pleasure to talk to Amy Donaldson and Laurie Farmer, who are with TiER1 Performance Healthcare. Hi, ladies. How are you all today?
Good. How are you?
Doing well, doing well. So I wanted to talk to you all today. We've had several interactions on several different levels over the past year since I've been with the Health Collaborative, and you all do amazing work. So for those who are not familiar with TiER1, tell us just a little bit about what you all do.
Sure. So thank you for having us. Again, Amy Donaldson, and I'm a senior healthcare consultant with TiER1 Performance on the healthcare side. And my work is around interim, performance improvement, quality improvement, project management, change strategist, a lot of different roles that we play within the healthcare system. And my colleague, who's also with us today.
Hi, I'm Laurie Farmer, and I work with the Accreditation Regulatory Compliance Performance Improvement with TiER1 Healthcare.
Okay, very good. Well, welcome again to both of you ladies. So from my understanding, and I'm still learning, I definitely am not the subject expert. I'm the event planner. I get to plan all the fun events with TiER1 with our lunch and learns and innovation sessions. So TiER1 assesses risk to patient safety. And so during this COVID-19 pandemic that we're experiencing, as we know, patient safety is extremely important and essential. So what recommendations has TiER1 recently made to providers to ensure that safety is the top priority during this pandemic?
Sure, that is a great question. I'd like to kind of just talk about a story that probably just really speaks to patient safety and the work that we do. So just recently, one of our colleagues was in the field before the pretty much stay-at-home order came on board. And as she was working with the team, they identified that they needed to start thinking about how do we redeploy nurses to other areas of the hospital where we may have increased patient needs. And the colleague was able to work with the client to talk about how do we onboard and accelerate that learning, that nurse who may be working in the OR to move to work as a team member in the ICU. And at that time, things weren't as hopping and weren't moving as quickly as they are now. And it really was the ability to help that client prepare for the now and also for the near. So, so with that, we really started thinking about how can we support that accelerating onboarding, that accelerating learning. And with both TiER1 Performance and TiER1 Healthcare, we came together and said, what can we do? And we really looked at a strategy of how we could quickly onboard through technology was one way to think about using tablets, apps, and how that would work. And then we also said, we've got to figure out how to assure that we're getting the competencies. I have said over and over on nurses and nurses and nurses, not true. And we need to assure that when we're putting frontline caregivers in areas that they are familiar with, that they're comfortable with the work that they're going to do, that they feel like they're going to be able to make a difference, and they also want to keep the patient safe. So we developed some work around that. And one of the really cool things that we found that was useful is QR codes. How to use a QR code to put on a piece of machinery that could be easily scanned to give that person the information they needed. So we really drove that around ventilators, thinking about all the different types of ventilators that were going to probably be used or maybe not used. But we had a client that was just really jazzed up about that and thought that is a great way to make sure that we have some just-in-time learning.
Yeah, definitely. Yeah. And I'm certain that during this time, there's been a lot of changes and different things that you've had to implement. So how has it been trying to tackle all these changes in healthcare and, you know, all the things that are happening on a day-to-day basis? You know, we're getting updates by the day, sometimes feels like even by the hour with different changes in the numbers and everything surrounding COVID-19. So how are you all staying on top of that?
Yeah, I'll let Laurie take that question.
Yeah. So our clients have really fielded some great questions, and we are just trying to disseminate all the information. Like you said, it changes every day. CMS waivers at the 1135, you know, they change from day to day. CDC recommendations change. So just staying current with those trends and giving, you know, our clients the latest information, having that readily available at their fingertips to provide that safe care. That virtual space has really been a challenge for connectivity and making sure, you know, that everyone can stay in contact with communication too.
Okay. So tell me, when you say clients, who are some of your clients, for those that are not familiar, who your clients are, who you work with?
They would be our healthcare organizations that we work with on a regular basis. We call them retainer clients. And we are offering a free consultation right now during this time to anyone.
Okay. So for instance, we're all trying to work from home. Well, some of us are working from home, not all of us. What are some things that you all personally maybe have had to try to tackle working from home? I don't know if you're working in your offices and then the stay-at-home order came about, and balancing your work-life balance with your day-to-day and being home. How has that affected you personally?
Yeah, so definitely, I think some of the requests coming from our customers, you know, they are working with these patient surge and what I call kind of a combat zone. So timeliness is key. So if they have questions about some of those waivers, or if they have questions about their own policies, just to turn that around quickly, you know, in real time to get them the answers. So a lot of times the hours are, you know, really early and really late, even though we're working remote. Just, you know, getting the information to them or any kind of policy edits.
Yeah.
You know, keep that flow going to their staff.
You know, I think the other space that's been really cool for us is that we've been able to really kind of had time to innovate and think about different ways that we could help our clients.
Yes.
And even to step into some areas for the healthcare side, to step into some other areas that's not healthcare. It is kind of healthcare related, but one of our clients that we're working with is a learning management system, and helping them deploy free training that they have to their clients and helping them get that out there to clients to use. So I think it's been been an opportunity for us as a team to kind of, you know, bounce ideas off each other, take time to learn about what our likes and dislikes are, and to gel. You know, personally, I think just to gel as a team, because when we are working, we're usually out on the road. We kind of call ourselves road warriors.
Yes.
And now we've been brought back. We're house warriors, but we've learned to use that virtual Zoom or Teams to stay connected. But we really, I think we've done some great work and ideas on how we can help and bringing those things to fruition.
Very good, very good. So like I said, with so much changing rapidly from day to day, what does this mean for TiER1 as far as in the future and the way we're looking at healthcare and how we are looking at social distancing and how, everyone is kind of trying to plan for things, but kind of like, I don't know if I should. They're taking, so many things into consideration. And honestly, I feel like it's kind of the silver lining where we're looking at our health more closely. We're thinking about our health and well-being more closely and top of mind.
Yeah.
So what do you think, what is this going to change? How is this going to change the game in healthcare as we progress? I can't even say when this is all over, but as this progresses.
Yeah. I think that's a great kind of a segue into, and Laurie can speak to it about telehealth and how that is changing. But I think the other thing is that there's going to be a new standard for clean.
Yes.
Yeah, a new standard for keeping our employees healthy. And I think that that's an opportunity, not only for the healthcare space, but for every industry, is just saying, how do we bring people back in? Or for those folks that are already there, how do we kind of re-educate them? And that's an opportunity. But I'll let Laurie talk about telehealth too.
Yeah.
Yeah, so with some of those CMS waivers, they are now allowing some audio visits with telehealth. So really releasing some of those restrictions for the compensation as well for the provider. So I do think that will be in our future where we've had some limitations in our past, but I think that will be fully used, especially with the use of smartphones and technology.
Yeah.
Have at their fingertips to get the care that they need, and then protecting that elderly and the vulnerable population in those areas. But it is a new, what everybody calls a new normal to progress through this.
Yeah, we're all adjusting. And I remember several years ago I was a flight attendant, and so if you're on the road and you get sick, you're not home to go to your primary care doctor. And so I was using one of the telehealth services and downloaded the app, and it was awesome, to see someone and talk to them and get prescription to be sent in to the local pharmacy wherever my layover was. And, I thought that was so neat. And I thought, so we've really stepped into the Jetsons age with this. We don't have the flying cars yet, but we've got this, and this is pretty neat. So I think, we're going to see more and more of this as the months and the years go on. And that may become our new normal, where you won't have so many face-to-face interactions with your doctor so much, but in the regular capacity of, general, visit. So, well, I don't want to take too much of you ladies' time. I have one more question for you. How has partnering with the Health Collaborative been instrumental in helping spread TiER1's mission?
It's a great question. I personally live in the Cincinnati area, so I seem very close to the Health Collaborative. I think the opportunities have been to kind of open our eyes to what can be and what we could do for the community as a whole for this area. I think TiER1P and TiER1 Healthcare, just the innovation side that we provide is something that we want to work through the Health Collaborative and those opportunities that are there. So it's been a great partnership.
Great. And Laurie, you're not local. I understand you're.
No, I'm not, but I love just the Health Collaborative being, that proactive communication piece in the community. Yeah,
definitely. Well, I certainly look forward to seeing you ladies again. Amy, I'm sure we'll cross paths in the near future as we continue to work together and partner. It's been a pleasure talking to you both today. I thank you so much for taking the time to share more about what TiER1 is doing in our community. Thank you so much, ladies.
Oh, thank you so much. Stay healthy.
I will. Have a great day.
All right. Thank you.